Bola Kintade. Okay, so our founder is Professor Abimbola Kintade, an associate professor at the University of Maryland and Honorable Commissioner for Health at the State of Maryland. So, and also the program manager, Mr. Adamove Osho, is also an alumnus of the John Hopkins University, like the School of Public Health. So then we have a group of nurses. Like I said, that we have the nurses school project. So we have a group of nurses. So I'm just going to mention consultant for the NGO. So to start, about the topic for today, that's distilling COVID-19, distilling the myths and the misconception. So I would like by saying on the preamble grant that this COVID-19 everything probably started in the year 2019, December, yes, where the first case was discovered in Wuhan in China. And just a quick one, in January, it was declared by World Health Organization as a public health emergency of international concern. And in March 2020, it was declared a pandemic. We had the first case in Nigeria in February 2020, and that's by an Italian man who came to Nigeria and was found in Lagos. And the second one in March too, someone who had a contact with the Italian man. So brief one, so far in Nigeria till date, out of over 200 million population in Nigeria, we've only been able to do a sample test of 3,207,523 out of 200 million. And confirmed cases, so far we have 209,546. The covered cases, 197,546. Currently, we have 9,162 active cases. And so far, we have 2,833 death rates. So far, death cases from this COVID-19 in Nigeria. You know, sadly, with all these issues and with all these figures and the rest, so many people still don't believe this COVID-19 still exists. There was shutdown, there was lockdown of economies all over the world and Nigeria also. But still, people still have this belief that it was just for the politicians to keep money, to make money for themselves. But they've forgotten that health comes first. So that's what Dr. Oladapo Asinyabi will be doing justice to. Dr. Oladapo Asinyabi is a public health physician from Lagos State. And I won't be saying much about him. Once I hand over to our founder, who will be introducing him and saying a few things about him before he do justice to the lecture. So I will hand over now to
Hello, everyone. Good morning to those of us in North America, I guess, and in other parts of the other parts of the world, and to those of us in Nigeria. Good afternoon. Thank you very much for taking the time to be here with us. As you're aware, Health for Nigeria has made it our mandate, to try to bring quality healthcare information that impacts health promotion and disease prevention on a monthly basis. So welcome to our monthly installment of welcome to our monthly installment of our presentation. So Dr. Asinyabi is here now. So he was having some technical challenges. Once again, Health for Nigeria's mandate is to try to get healthcare to everyone in Nigeria, regardless of socioeconomic status. We recognize that this is a significant challenge. We can't fix it in a day. We can't fix it by ourselves, but our goal is just to contribute our part. Just whatever little dent we can make is what we've set out to do. One of the ways that we're doing this is we've started the nurses school program, as Mr. Olumide Obe was mentioning earlier. The nurses school program actually goes into schools in public rural areas, and we renovate spaces there. We turn them into clinics. We hire registered nurses, and we place registered nurses in these schools. The registered nurse has several mandates. The first mandate is to help with COVID-19, and that's part of what we'll be talking about today. The second thing is basic first aid. We actually understand that a lot of the kids unfortunately endure injuries or have healthcare challenges that either prevents them from coming to school or impacts their ability to learn when they are in school. The third thing is our nurses actually start health clubs in the schools. So we're trying to infuse health promotion and disease prevention, into our children at an early age. Those were our three original mandates, but what we recognized is with our clinics, the clinics are actually in rural areas, so our nurses have now essentially become community health nurses. And the nurses school program has now sort of grown beyond the schools. So once a month, our nurses go out into the community and we have community outreach engagements, which has been very helpful. We also realize that we have young children with chronic diseases. So our nurses are now also visiting homes and helping to educate parents of those children. So our ultimate goal is to improve our children's ability to learn, by not necessarily only impacting their ability to read, but just to ensure their health is preserved so they can do better in school. So thank you once again. I just wanted you to know a little bit about who we are and exactly what we do. I am going to introduce our speaker today. He is near and dear to my heart. So this is Dr. Oladapo Asinyabi. He is a public health physician with expertise in public health, epidemiology, and sustainable development across various corporate and health service organizations. He has made significant contributions to the development of the Lagos State Health Policy document with significant impacts in Lagos State Strategic Health Development Plan, the Lagos State Primary Health Care 2016, 2018 review using bottleneck analysis, public-private partnership policy, the Lagos State Ministry of Health in 2016. In 2018, the elimination of mother-to-child transmission of HIV and AIDS, and the Lagos State Ministry of Health's public-private partnership policy. Over the course of his career, he has developed efficient health and social strategies to facilitate access to universal health care and community-driven projects across different states in Nigeria. His passion for services drives him to build and maintain long-standing relationships with his peers and patients. One of the other reasons why I believe Dr. Asinyabi would be the perfect person for this presentation is that he has actually had personal experiences from or with COVID-19. So, who's the best person to talk about COVID-19, not only from a theoretical perspective, but also from personal experience. So thank you very much, Dr. Asinyabi. I'll hand it over to you, sir. So it looks like Dr. Asinyabi is having some technical challenges.
Yeah, I think we've lost him for a bit. Try to get him back into the meeting.
Please be a little patient with us. Network connectivity can be a challenge in Nigeria, so Just give us a couple of seconds, and I believe Dr. Asinyabi will be right back with us. While we wait for Dr. Asinyabi, I'm going to make a couple of comments. Today marks the 1-year anniversary of the End SARS protests in Nigeria, where a lot of well-meaning Nigerians had the peaceful protest in several areas in Nigeria, but most notably the Lekki toll gate incident. So as we go about our day, we should stop and just take some time to remember those who attempted to try to speak on behalf of the masses in the nation, and they lost their lives in the process. So that's the one thing. The second thing is, for anyone who has been a part of our monthly lecture series, you'll notice my background has changed. So I worked from home for the last 1.5 years due to COVID. I mean, it's timely that we're talking about COVID-19 today. So a couple of weeks ago was the first time I actually got the opportunity to come back to my office since March of 2020. So it has impacted all of us one way or another. Mr. Osho, do you see Dr. Asinyabi back online?
He's trying to reconnect now. Should be coming in shortly.
Okay. Thank you for your patience, everyone. Just give him 1 or 2 minutes.
I'm so sorry. So sorry, network challenges, so sorry.
No worries,
No
Dr.
problem.
Asinyabi. Welcome. The floor is yours.
Thank you. All right, let me share my screen. Please, can I share my screen?
Yes, let me make
Permit me
you
to.
do that. Yeah.
Thank you.
Mhm. You should be able to do so now. So.
Okay. All right, good. Okay. Can we see my screen now?
No, not yet. We can't see your screen.
Hello?
Dr. Asinyabi, we can't see your screen
Can I
just yet.
proceed? Hello?
Yeah. We can't
Can I
see
go
your
ahead?
screen.
Okay, and you can hear me.
We can hear
Yes,
you.
we
We
can hear
just
you,
can't
sir.
see your screen.
Yeah. Thank you for being here. Sorry, network has just been challenging, but let's see how this goes now. Okay, so we'll be talking about myth and misconception. whether the network likes it or not, we'll do this. So let's try and make it as fast as possible. Hello?
Yes, sir. We can.
What we'll be talking about. So where are we coming from? So I'll be thinking about us thinking, we should keep testing, treating those who need it. We should top up our immune system with our vaccination. And we should talk to those who are professionals. Okay, so
Yeah, I think we've lost him again. We'll try to get him back in one more time. Apologize for the technical difficulties. It's always a challenge with network here in Nigeria.
Yeah, this is one of our unfortunate realities in Nigeria. So we appreciate your patience. Dr. Asinyabi has actually been on a couple of our panel discussions, and he really does bring a wealth of knowledge and experience to
recording in progress
to the subject matter.
So I'm back again. So sorry. So I'm using two devices now. So if the one that has the presentation goes out, I'll just keep talking. I have the presentation in front of me. Then I'll be logging in as it comes. So please, let's just bear with me. All right, so where we're coming from, everybody is affected or concerned. Okay, so this is COVID in Nigeria. Started in Lagos. Don't worry, I'm still on the mobile one, so you can see me. When the presentation, our first case, I know you can see me, don't worry. Okay, so after COVID hits Nigeria, of course, we go into our own response mode, just like the rest of the world. Now, this was it, the first confirmed case. Okay, so went to the WHO. I'm sure over 5, or please just bear with me. Okay, so this is what the world says about COVID now. Am I unmuted? Yes. And this is the Nigerian situation. This is the world situation as of today. And this is the Nigerian situation. So we've had definitely over 1 billion people have been affected. And we've had more than that. Those who have been all right, so now what do we want to achieve? Okay, sorry. I think
recording in progress.
Yeah, okay. Network is not making this thing interesting.
Dr. Asinyabi, we can't see your slides, so don't even worry about the slides. You can just
okay, let me just talk about it.
Yeah, you can just talk about it.
Yeah. Okay. That's what I'm being. You can see me, right? Okay. Okay. trying to get out of this slide. Okay, so where are we now? That's the issue. Many people have been infected, many people have been affected, the global economy has gone down, travel has gone down, families have been separated, some families have been shattered. There are many widows, widower, and there are many orphans, all due to COVID. So where do we stand and what do we do? We all know what COVID is. It's a viral disease. And unfortunately, and unfortunately for now, there is no known cure for now. So what are we all doing? We're trying to see how well we can prevent and how well we can stand in the midst of the pandemic. Now, luckily and good for us all we've had a way out, which is the vaccine. And we're all trying to see what we need to do. Let me tell you a little bit about my own story. So I've had COVID twice. The first time, it seemed like
Dr. Asinyabi, would it be easier if you turned off your camera so that
but the next time it wasn't funny. I almost lost my life. I'd moved from being a preacher into people who had pre-existing no way I was going to put myself out. I didn't hear you.
I was saying it might be easier if you turn off your camera, and you can also send one of us your slides and we can upload your slides and we can advance the slides for you. And then that way, hopefully the network would be better.
All right, let me try and send the slide to you, and then we'll be back. Just give me 30 seconds. You'll get the slide. Yeah. Okay. All right. Okay. Should get the slide soon on your WhatsApp. Let me continue while we wait for that, while you wait for that. Okay, so like I said, over 1.5 million households. So while I went about doing that, coordinating the team, I got COVID from one of the private hospitals. Because I remember I met a nurse who said she met somebody who was COVID positive, and 2 days later, the nurse was positive. And I went to test and I became positive. That was the first time. The second time, I started feeling feverish, felt like the malaria. I went to do the test, I was positive, and by the third day, my life was hanging in the balance. And that's what happened. So I went into isolation on both occasions, 2 weeks, recuperated, had some of the long COVID symptoms. For like 3 months, I was having severe back pain. even though I was negative, and that was what happened. So now, what do we do? All right, so we know what COVID is. COVID is just the virus, while the disease itself is COVID-19. So we know what it is. We know the mode of transmission 2 ways. It's either you have it from human to human transmission, or when you get in contact with a contaminated object. However, it's not that the human to human transmission, you must be on sustained contact for about 15 minutes. That's when they're likely going to get COVID. Now, so who are those that are infected? Everybody is now at risk. Elderly, young, children, working class, professional, non-professionals, VIP, non-VIP, everybody. But some people get the worst end of the stick. That is elderly people, people who have chronic disease, diabetic, hypertensive, sickles, and all those. Those with HIV/AIDS, anybody who has a pre-existing condition. People, everybody can COVID. So it's not a respect of age, person, time, or where you reside. There have been a lot of myths. Some said, this COVID does not affect those in tropical or okay. So, but the evidence does not support that. Whether you're in Nigeria or you're in Florida, or you are in Amazon, or you are in the desert, in countries where they have deserts, everybody gets COVID. So what are those symptoms? We know: fever, cough, tiredness, weakness, aches and pain, nasal congestion, sore throat. Some people have diarrhea, and some people lose their sense of smell and taste.
Dr. Asinyabi, is it okay to stop and ask you questions in between? A couple of people have raised their hands, and there's a question in the chat. Dr. Biodun Fasimi is asking, is COVID-19 more dangerous than malaria plus cholera or dysentery?
So we should get COVID test. Everybody should get COVID tested now, really. Because, I mean, we've passed the stage of who is exposed or who is not exposed. Everybody is exposed. So if you think somebody around you is feeling ill, no matter the type of it, please add COVID to your test so that we'll know it is out of the way. If it's out of the way, then we can deal with the other things better. Now, but along the way, treatment, people are getting afraid, are tired. We've been praying for a vaccine. We finally get the vaccine towards the end of last year, and everybody rolls out vaccination. Of course, there is a vaccine access disparity. As usual, those who are well off have access more than countries who are not well off. So rich countries have bought the vaccines, and after they have reached 60 to 70%, they are remembering those of us, and WHO and some other partners decides to put up COVAX so that more countries will have access to vaccine. So how does the vaccine work? The vaccine works when anybody gets infected with COVID virus. It can take days, weeks, but the body develops what we call germ fighting tools needed to get over that infection. After infection, that person's immune system remembers what it learned about how to protect the body against that disease. So there's a memory thing. Now, with COVID vaccination, the body is now sensitized to develop those germ fighting tools more, faster, and more efficiently. So in future, when the body now gets in contact with COVID, then the body knows how to deal with COVID better, faster, and more efficiently using those germ fighting tools. For some of us here might not be medical, so that's why I didn't want to use those medical terms. But we call them antibodies, we call them immune response. So there are 4 main types of vaccines for COVID. There's a whole virus vaccine, a whole virus. But this one is weakened and is injected into the system. The system remembers it. Because it's weakened, it's easier to fight it off. This is what we do for our regular yellow fever and measles vaccine that we give children. So it's not new. Using whole virus but has been killed. It's called live attenuated. So it is practically dead. It can really do not do much. So that's the kind of vaccine you see in the Chinese market, Sinovac. That's the technology behind that. Then there is the mRNA or RNA vaccine. This one uses molecules of RNA in the lab. They code for part of the COVID virus, especially the spike protein, which is what is used to attach to human cells and infect us. So that's what, this is a new technology, and that's what you find in the Pfizer and the Moderna vaccine. Then you have the non-replicating viral vector. So what they do is they put part of the COVID vaccine in another safe vector so that it can live. The challenge is because by itself, it's easier to destroy if it has been killed. So they put a vector in. Sorry for that. So that's the technology behind the Oxford AstraZeneca and the Russian one, Sputnik 5. So the vector is just, the virus is not just part of the vector. Then there is another one that uses just subunits of the germ. So it doesn't use the whole germ. And so your body still recognizes. So all this is just taking part or whole of the virus so that the body can all right, so in all this, we will, every country now has their own drug regulatory agency, look at the data, look at the development, and then approve it for use. So for Nigeria, it is called NAFDAC, for USA is FDA, for UK is MHRA. So for Europe is European Medicine Agency. So they look at it and then approve it safe for use for their people. Now, there's so many myths that has been going around. If I will, when they shared my slide, what I'll be talking about now has to do with a lot of facts. Facts are better. Okay, so facts are better than myths. So you see on that slide some facts. Is the virus safe? Is the vaccine safe? Should I get COVID vaccine even have been infected? Well, it's been found out that people who have had COVID vaccine, people who have had COVID and then got COVID vaccine are more protected. If you get the virus and you didn't get the vaccine, you are 2 times more likely, according to a research, to contract COVID more than those who got the virus, got infected, and then got the vaccine. So it's a game of chance. If you want to leave yourself to remaining with a high chance of contract, fine. Some people have asked that, why is it that, why, or as the vaccine, does it contain metal or does it have a chip? Well, the dose of the vaccine is just 0.5 mils. So if you know what 0.5 mil is, let me see. Yes. So if you see a teaspoonful, 0.5 mil is like half of that teaspoon. So if that is the amount of vaccine quantity that is injected in you, if you have a magnet that is that size, I'm not sure a magnet that is 1/4 of a teaspoon or half of it can hold a whole spoon. Now, the world has been vaccinating people for years, and we didn't see a reason why we would track people with that. So, and there are no magnetic properties, or no magnet can be put inside that for it to work. Okay. So that's the situation as we are now. What else? Okay. Also, people have raised the fact that the virus only affects rich people in some part of the world. However, from what we see, everybody has been affected, and therefore, it does not discriminate between the rich or the poor. The only reason why people think that, especially in this part of the environment, when a rich man dies, everybody hears about it. When a VIP dies, you are likely going to hear about it. Than if Dr. Asinyabi dies. I mean, I'm sure if the governor was ill, when President Trump got COVID, the whole America had, but there are many people who got COVID and nobody had. So that's why people think it's only rich people. All right, so the virus, some people say the virus can be spread through mosquito bites. Well, if that's the reason, then people in countries where there are no mosquitoes will not have COVID, but unfortunately they do. So those are some of the myths that we've dealt with. Let me see some other ones. Okay, some people say, well, natural remedies can be used to prevent and treat COVID. Well, there is no scientific basis for that. If that was it, if garlic worked, then we'll not have the amount of COVID infection and death we had in India. Garlic is consumed in large quantity, so it's not likely that will be. What else? Yes, some people have said that, yes, if we get the COVID vaccine, people are going to die in 2 years. That's really funny. I don't know how people will know that people die when the vaccine is less than 2 years. So I don't know how they're able to program ahead of the length of time that the vaccine has been around for us to know that people will die in 2 years.
Dr. Asinyabi, are you still with us? I have to say, while we're waiting for Dr. Asinyabi, I'm enjoying the conversations and the chats. You know, it seems like there are so many myths that we've heard about. You know, so I'm really hoping Dr. Asinyabi would be able to help us address many, if not all of them.
I don't know if you might be able to speak on some of these, but I feel like there are a few people who might want to voice some opinions. I think while waiting for Dr. Asinyabi, maybe we can take one or two people to just discuss. Oh, I think he's back. All right.
Dr. Asinyabi, are you back with us? All right. While we wait on Dr. Asinyabi, a couple of people raised their hands earlier. So one is Dr. Fasimi, and the other person is Martin Zokigwe. So can you please unmute and ask your question or make your comment? This is probably a good time to do that.
All right, thank you very much. Thank you very much for this platform. Glad to speak to professionals in the industry across all divides. And yeah, my name is Dr. Biodun Fasimi, and I'm a researcher. And I've had concerns about COVID and the vaccines. I'll start with COVID. And if this is a myth-busting platform, I would really be glad to have whatever myths I present here today busted, you know. First of all, in the comment section, the first inquiry I made was, how important is COVID-19? Is it more superior to malaria? Does it have a higher death rate than malaria, cholera, dysentery, and other diseases that affects us as people in Nigeria? I don't want to talk about the whole world. I will speak for Nigeria today because I'm in Nigeria. Yes, you may say it's a pandemic. By all definitions of pandemic, it's a disease that affects multiple people across multiple countries at the same time. But if 2,700 deaths have been recorded in Nigeria in 20 months, and we have had just about 250,000 thereabout cases, oh no, less than 250,000, and 100, I think 230 thereabout, and then 195,000 have recovered, you know, and then you have less than 12,000 active cases of COVID in Nigeria at the moment, based on NCDC data, which is available with any Google search. My question then arises, is COVID the most important disease affecting us in Nigeria at the moment? Let's bear in mind that COVID has a 99%, maybe 97% recovery rate. You know, if you have COVID, I mean, 195,000 people recovered in Nigeria without any, like Dr. Asinyabi said earlier on, without any known cure, and 195,000 people recovered. So the question is COVID, which I'm asking, is COVID the most scary disease and most scary infection that we should be concerned about in Nigeria? That's number one. And then number two, I'm talking about I said it in the section, the comment section, that I had opportunity to speak to raise this with the DG of NAFDAC some months back. And I asked, I said, what are the pre and post market validations what are the pre and post market validations carried out in Nigeria?
I'm in a meeting, that is why I can't reach me.
The PCR tests were, before the test kits came into Nigeria, and also before the vaccines were approved or maybe vetted in Nigeria for it to be administered, what data has a nation? We have professionals. I mean, we have doctors, we have pharmaceuticals, we have pharmacists, we have professional, we have laboratories, we have universities that are supposed to be bodies of science. What work was done as a nation in Nigeria before we accepted everything that was brought to us? I mean, I have tracked every single story, both on the pro and against the on both sides of the divide, from the development of the vaccines to the very present. I mean, you all will agree with me here that nobody owns the right to science. You cannot tell me that there is no, you can't tell me what is acceptable in science. Everybody has equal rights to do his own research, to carry out his research, to bring out his own findings and make his own assertions. If the hypotheses are accepted, then we look at it and theorize it, and then we take it from there. So if our governors and some people are recovering from COVID and stuff in Nigeria without any known medical care, does that not suggest to us that as a nation in Nigeria, we can actually look inwards and solve our problems within? Because look at what's happening to the economy. I don't know if you know the cost of one of those vaccines. It's costing us an arm and a leg in this country. You say it's free, it's not free. Payments are being made for those things. Look at Moderna, Johnson & Johnson and Moderna are first timers in producing vaccines. This is the first time they're producing vaccines. And go check out the board and tell me whether it's a make-believe that the guys behind Moderna are currently already among the list of billionaires in the world. It's costing us an arm and a leg as a country for us to entertain importation of vaccines into the country. So my question again is this: why are we not talking about a treatment? Why are we heading straight to vaccines? I mean, malaria has not had a vaccine for almost a whole lifetime, and we are treating it. Almost everybody in Nigeria, if you go for a test right now, they will tell you have few malaria parasites in you. So the question is this: is COVID the biggest problem we have right now as of today in this country? I have a lot more to say, but I want to give other people the opportunity.
I was actually going to like...
I'll have time to, to come on later on to have some more words with the team. Thank you very much.
Thank you very, very much, Dr. Fasumi. And you've raised the types of questions or discussions that we should have, not only to be pro or antagonist, but just to have more information so we understand exactly why we're doing what we're doing. So Dr. Asinyabi, I hope you heard the questions. Can you please answer?
Thank you very much. I heard your prayer, Dr. Fasimi. Thank you very much. One, let's put out the facts there and the reality of what the system is. One, what COVID has done is shown that health systems, especially in this part of the world, is weak. So that's what it has brought. Two, and the weakest part of that system is the primary healthcare system, because it's supposed to be the closest to you. Now, you raised a question about is COVID the only thing? Of course not, and we've not stopped working. Now, when COVID came, nobody knew anything about it. When COVID came. So it is not like TB, it is not like malaria, it is not like even the regular bleeding that causes death of most pregnant women. We already had a treatment modality, we already had control systems ready for those ones. It's just that our system is weak. That's just what it is. So COVID coming, nobody knew what to do and everybody was learning along the way. Now, so we all learned along the way. And my view is that one, everybody overreacted to COVID. Yes, the data you are saying, yes, 80 to 90% of people recover, yes. But that's only for those that were able to test. Let's not forget, there are some people who died and we never knew they had COVID because we never tested. I work in the primary healthcare system in Lagos, Nigeria. When COVID started, like I told you, I was in Lagos Island. the number
Clear?
of people who died. Number of people who
Come on,
died.
Churchy.
Are you listening? That we could not say this is the cause. Now, because of our environment, people refuse to get tested, even post-mortem. So that is one issue. That's part of the poor health system. Not knowing the cause of death is one of them. Now, with data, I will share that with everybody. NCDC and NAFDAC did a serological survey, I think sometime in August last year, to give us an idea of how many people may have contracted COVID along the way. And in Lagos, it showed that 1 in 5 had had COVID. So if you're an epidemiologist and use that as an extrapolation, it will tell you many more people have died of COVID, unfortunately, but you cannot say so if you don't have a test. Autopsy cannot show you have COVID, it's a test. So that's why I said here, we cannot. I am the head of the public health department. I'm in Ikeja and I was in Lagos Island. I asked those people to avail themselves with autopsy. Of course, because of the environment, people told me, why do you want to disturb the dead? So what do? You can't force people to do an autopsy if they don't want to. They went, they buried, and they went away. So some might still be happening now. People are afraid. People don't even want to know they have COVID. That's the feelings we're having in the community. Why? Because people feel that their COVID risk is low. Because the death rate of COVID is low. So I see a comment that is not a reason. You cannot force people to do autopsy. We do not have the capacity to force people to do autopsy as we are in Nigeria. So we really cannot know. I've just given you data about a community survey that was done by NCDC and MPHCDA. It gave us an idea of the number of cases we may have had, but have missed. This is what you call an iceberg effect. What you see at the surface, that's what the data shows now, is the only people we're able to get to. So that is the first thing. The second thing you raised was the issue of, is it the only thing? No. So the health system is weak and we're trying to sort it one after the other. We know we have more deaths from malaria, yes. We know we have more deaths from vaccine preventable disease, yes, we know that. However, saying it does not equate to bringing up things that will just make it work or change overnight. To do that, you'd have to have personnel, you have to have funds, you'd have to have the technology, you have to have the administrative know-how. So why am I saying this? It costs about $10 to vaccinate a child if you look at the supply chain system. And this study was done by MPHCDA and European Union Agency. So if it costs about $10 to immunize a child, $10, Nigeria's population is over 200 million, and 1/5 of that are children under 5. And 1% of that are children under 1 who are eligible for vaccine. 1% of 200 million is 2 million. So if you need to vaccinate them, you'll be talking $20 million. That's what you need. I'm not sure our budget can carry that for now. And that's why you will not see a change overnight. Then you need and that's just cost of the vaccination and the logistics. We're not talking about the food soldiers, the health workers and all that. So as we are now, as I'm talking to you now, I'm actually preparing the LGA team in Ikeja to go and vaccinate children with oral polio. And we'll be doing that from 30th to 2nd of November. We have over 8,000 people who will be going from house to house. And that's the only strategy we can use to reach children, to ensure that we don't have a resurgence of polio, to put a lead on our polio certification. So imagine if you pay each of them 5,000, see how much that comes to. So the challenge is, one, So one, our health system is weak. COVID is not the only thing that we are facing. We are facing other diseases. But our health system is weak, and there is not much anyone can do about that overnight. Now, for those who have been infected or affected by COVID, it will be a disservice to say that, please stop talking or doing a response about COVID. What we should be doing is strengthening the health system such that everything can plug into the health system and we can all move forward and make life better for everybody. So that's as per some of those things you raised. You talked about, yes, vaccine validation, pre and post-market survey. Please, vaccine is just like any other drug. It's another type of drug. I'm not sure it's every drug that comes into everybody's market that we do a study on, or we validate by saying they should do a new clinical research. That's not how drugs are accredited everywhere in the world. It's not every country that needs to use a drug that you repeat the study. What most people do is share data and see how well it works. The next thing you move on to is do a post-market surveillance, which you continue to see the effects of the drugs on your community, and then improve your data and then domesticate it. Now, that has been done in Nigeria for the vaccine. A study was just released. It was done by Professor Shibugu of the Community Health Department in conjunction with MPHCDA. Over 1,200 people were put in that study to see the report of side effects of the vaccine. And they found out that more than half had reported slight side effects, and that the side effects were even more amongst the elderly and those with premorbid conditions than those without. I'll share a link to the report of that study. So you cannot repeat a study to validate a vaccine in every country or drug. I'm not sure it's all the drug. We use cancer drug, we use drug for heart failure. They did not repeat all the studies in Nigeria. That's not how it is done. What you do is share the data of where it comes from, and everybody follows this. And that's why you have people in NAFDAC, and that's why you have other heads. And then the post-market adverse event follows, which we are doing. Everybody who gets the vaccine in Nigeria gets a card. On that card, on the front page, you will see a number there. If you have a side effect, please report it. That number, whether you send an SMS or you send a WhatsApp or you call. So there's a program in place to monitor the post-vaccination effect, which we call adverse event following immunization. That's what we do. That's what we have been doing for all the vaccines we have. We only plug COVID into this process. It's not a new process following AEFI. So we follow it from the facility where you're vaccinated up. And then we make a report from local government to the state, to the national level. Then an expert committee looks at it, we investigate, and then we feed back. So that is what we do generally. Thank you. No, it wasn't a vaccine study. It was a post-vaccination adverse event follow-up for 3 months. So I will put the link. Don't worry, I'll put the link on the chat so that all of us can also see. Thank you. Any other question? I think I see.
Yeah, there are a few questions. I think I'd like to have
Yes.
Dr. Olateju. She has her hand raised for a while.
Okay, thank you.
To speak.
Thank you, everyone. I just wanted to make a note to what Dr. Asinyabi said. While the efforts have not been perfect, we all know, we're still dealing with this COVID-19 pandemic, well, globally. I think it's important to note that the efforts as of today have averted many deaths than we know. Yes, COVID-19 may not seem like the most, or let me say the biggest thing we have to worry about in Nigeria right now. But it's important to know that COVID, people with many underlying conditions at, higher risk of severe illnesses from COVID-19. And we all know, CDC is saying, cancer, chronic disease, liver diseases, lung diabetes, heart condition, HIV, and other, immunocompromised infections or people with immunocompromised states. Now, look at the leading causes of deaths in Nigeria. You can't take away some of this, HIV, TB. So yes, you won't hear, reports of rich people dying from COVID because why? They have, access to, good medical care that would prevent them from all this. But who is at risk here? That's what we need to start thinking about. The people that are uninsured, people without, clear access to, all this, medical, clear access to medical, to clear access to medical infrastructure. So if we have access to COVID vaccine, I think we should try to accept it. There's a lot of debunking that has, it's in writing. It's been debunked. The nanochips, COVID-19 is safe. We have a lot of vaccines, polio. There are lots of things out there that have brought us to where we are today in science. So I want people to really approach the COVID-19 vaccine as one of it. Yes, if you get the COVID vaccine, it's not the ticket to you can die from it. No, but it would give you a whole lot prevention and protective effect than not getting it at all. So I need us to start thinking about this. And as I know, not everybody is in the medical field, but there is a lot of research, a lot that has been put into to support the safety and effectiveness of this vaccine, like many others. So I just wanted to note that. So again, it's not the people that are rich, it's for the people that are helpless. It's for people that don't have access to insurance, to this vaccination. Those are the people that end up being hurt the most. And the data, there's not a lot of rich data out there. There's poor testing, there's poor tracking. So you would not find a lot of COVID attributed morbidity and mortality or COVID related attributes. So you won't see it out there that a lot of deaths are related to COVID. But yes, I'm hoping that in the future, there will be a lot more research that are focused on, that are more targeted into deaths, looking at deaths and attributing them to COVID. Thank you.
Thank you very much, Dr. Olateju. I think your comments raised a lot more hands and a lot more questions. Dr. Asinyabi, are you still with us? Would you like to say something before we allow another person to make a comment?
Yeah, I'm here.
Yes, sir.
I'm here. Yeah, I've heard what Tosin said. Like I've acknowledged, our health system is weak.
I think we might have lost him for a second there.
I'm sorry, just to suggest, is it possible we could entertain, while he's not available, maybe we take some other people,
What did you say? Sorry.
people who are raising hands. I just thought to suggest.
Yes,
Yeah,
I
yes.
think we should.
I think Dr. Akintade is speaking right now, but I'm not sure if we can hear him. But I agree. Let's go on to. I think Mr. Martins Okigwe has been mentioning a few things and has had his hand up. So please, you can unmute yourself and speak.
Should I
Hello,
go
good
through the, yes.
Good afternoon.
Good
Yeah,
afternoon.
this is Dr. Martins Okigwe. I'm a
Sorry,
medical
Okay.
doctor. I practice here in Lagos. I've been in frontline COVID management since almost about the beginning of the pandemic. Worked in a couple of isolation centers, though private. I like to keep their names withheld because, you know, I'm speaking in personal capacity here. This is a myth busting meeting, so it got my attention. So I'd like to first of all bust the first myth I had while I was here. Dr. Asinyabi earlier said that an autopsy cannot show a COVID diagnosis. That's only the test. No, that's a myth. Autopsies can show a COVID diagnosis. We just don't do a lot of them. All right, so I want to put that straight. I've really been following from the beginning, and he has mentioned a few things that got my attention. He talked about double safety being demonstrated in people who had earlier contracted the virus naturally and then being vaccinated. I'll really be interested in seeing that study. You know, a lot of times when we say a study has shown something, there is also the part of looking at the methodology of this study, looking at the sample size, looking at whether it was double-blinded or not, and looking at all those things that give studies integrity. At the beginning part of this pandemic, we had a big wig like Lancet had to retract a study, which they put out. So, the fact that a study comes up is not enough. We need to see the study. We need to see
comes up is not enough.
Yes, we need to see the we need to see the study. We need to see the methodology, because earlier this year, you know, I followed up with Merck, MERCK. They are an American pharmaceutical company, and they had 2 vaccines in the works, and they also had 2 therapeutics in the works, right? And Biodun Fasimi earlier on, Dr. Biodun Fasimi, I'm sorry, earlier on mentioned about why are we not pushing for therapeutics? I'd like to ask that too. But this particular company, MERCK, Merck, right? They actually abandoned their vaccine program just in January this year. You can check that up. And they abandoned it because they found out that immunity from natural infection far surpassed the vaccines. And not in just one measure, it far surpassed the vaccines. And so they stopped then and focused their attention on therapeutics, right? And now, just about last month, Merck announced that they have actually anti-COVID drugs. I don't know if anyone on this call is aware. We currently now do have anti-COVID drugs by Merck. It was announced sometime last month by CNN. All right, just that those that are interested are not really interested in it, right? So that's a big no for me. I don't think that study was done rightly. I'd like to see it, because even basic immunology, it goes against basic immunology, because a vaccine only tries to mimic the actual virus. It tries to mimic it so that your body T cells and other immunity immune components recognize that vaccine, prepare the body for it, recognize that pathogen, prepare the body for it, and respond better the next time. So there is no way that the body would have seen the actual pathogen and would respond better to a foreign pathogen that is not the actual pathogen, that was based on the actual pathogen. That beggars science. So I'm really curious to see that paper. Moving on, people made some concerns about the vaccine containing what I would just call, no, let me get to that later. I have a question I want to ask and I want to put to you. Number one, I've asked it like 4 times in the chat, nobody responded to it, so I have to bring it here. Do we have objective data that shows us that people who have been double vaccinated, fully vaccinated, and that still die of COVID are actually not dying of short-term or long-term COVID vaccine adverse effects, or dying from COVID-type illnesses caused by the vaccines themselves, because it's not the first time. When polio was distributed, OPVs, especially the ones, the live attenuated ones, people actually got polio from taking the vaccine. And it's the same with other vaccines. So it's not impossible that people that are dying from supposed COVID, even after being fully vaccinated, are actually dying from adverse effects or dying from COVID-like illnesses that are caused by the vaccines themselves. That's not impossible. But nobody is discussing that. I'm surprised at that. Also, he mentioned that the vaccine volume is too little for us to have metallic substances that might be a problem. No, I do not think so. There is nanotechnology. We are not the first. I mean, there's so much that Elon Musk is doing with nanotechnology, especially in Neural Connect. What the work he's doing in transferring consciousness to apes and other animals. These are all nanotech. All right, 0.5 mils is a whole lot of volume for that to work with. Secondly, I don't know if Dr. Asinyabi is aware or conversant with the phenomenon of magnetosomes. These are organic substances that actually pull a magnetic field. And 0.5 mils is too much. We're talking about things that are at the cellular level, and they have this effect. So 0.5 mils is too much. I thought that was pretty, I don't know, it sounded a little bit late to me. I mean, it's too much, really. And then the safety of this vaccine. I heard someone say on this call definitively that yes, it was I can't remember her name, the doctor that spoke after himself, a lady. She said the COVID vaccines are safe. My sister, I don't know if you are willing to put your license on that, because the guys that made the vaccines themselves are not willing to put their license on it. There's an indemnity by every company that's currently producing these vaccines now against side effects and against the unsafety of it. They have an indemnity. They are not to be sued. You do not take such an indemnity if you do not expect problems. Your government is also has that indemnity, so you cannot call anybody up. You don't do such things for safe drugs. In fact, every of the vaccines currently out being distributed now are being distributed under the EUA, the Experimental Use Act, which classically categorizes the mass vaccination as a big old phase 4 experiment. So I don't know how a professional would stand with her full chest and say categorically that the vaccines are safe. Even the people that made it don't say that.
Okay, sir. I'm going to come in on what you just said.
Thank you very
now,
much.
And I think,
okay.
So safety is based on what the evidence says. If you can pull research evidence, noting noting that these vaccines are not safe, it's all based on evidence-based. So I don't work blindly on indemnity. Yeah, everything has that indemnification clause. Everything, even in the accounting field, you sign a paper. There is always an indemnification clause. So safety in public health, in medicine, is based on evidence. There is enough evidence based on research that this vaccine is safe and effective. So if you can pull research articles debunking the safety and effectiveness, I am well with you. So I am going based on research.
Wait for your turn, ma. You can write it down and get back to me. You're being rude right now. Don't do that. Don't do that, please. It's unprofessional.
Sorry, Mr. Martins, please hold on for a second. Thank you so much for your concerns. Please, I just wanted to say, we have a lot of people here that also have a lot of things. You've asked 2 critical questions. So I want you to give us time.
Mr. Osho, can you hear me?
Yes, sir.
All right, so everyone, I mean, our goal for this platform is for us to have these types of conversations. And, you know, I actually welcome the contentious conversation, because this is how we're going to learn. I would also just please ask for an opportunity just for civility and respect as we share our views. None of us, no one on this platform has the single-handed knowledge, you know, about COVID, you know, that is far-reaching. I think all of us have encountered COVID in different ways. And the reason why we asked Dr. Asinyabi to have this presentation for us today is he doesn't only work with COVID directly, he has also had COVID, you know, so I mean, I think we should respect that some. Please, by all means, put your comments in the chats, and let's just remember that our comments, some of them are just based on our thoughts and opinions. I gave an opinion earlier about vaccine mandates. I'm a frontline worker. I'm sorry, patients have died in my hands. I believe in vaccine mandates, but I'm not pushing it on anyone else. Those are my views. You know, so when I have to suit up like I'm going to the moon to take care of COVID patients, I am the one in front of that, you know. So when Dr. Asinyabi also is presenting his perspective, let's respect each other's vantage points while we're still sharing our views. You know, I would ask for that, please. Let's be civil and cordial. This conversation, I mean, is going to elicit these types of emotions, and that's kind of what we want. I mean, you know, we want to walk away with questions, with deeper questions, trying to figure out exactly how we can be part of the solution. All right, so thank you. I would actually like to bring back Dr. Asinyabi just to make a couple of comments, because this really is his presentation. Dr. Asinyabi, are you still with us?
Yes. All right. I'm with you. I'm with everybody. Thank you for those comments. And that's what makes engagement and questioning and human life interesting. I believe that nothing should be taken at face value, but at the same time, I also believe in looking at things critically and presenting them properly with the right context and the right perspective. So some few corrections from the last person. He said vaccines are used under experimental use approval. No, that's not what EUA means. EUA is emergency use approval. So it's not experimental. Let's be clear about some of those terminologies. Is emergency use approval. And we've had drugs that have been used under that domain. For example, the current malaria vaccine that everybody is shouting. The approval is going to get for this use because everybody wants, we have not been talking about malaria, it should be vaccinated. The vaccine will start with an emergency use approval. It's made by GSK. And the result was that it was only actually effective over 50% of those that were trialed for over 3 years in like 4 countries, Malawi, Ghana, and one other country. Please, we can check that up too. So this is not the first time the world will be going the way of emergency use approval because the benefit far outweigh the risk. That's the basis. Many people are dying of malaria, so we cannot say until that vaccine can reach 100% before we will say we will start using. No, that's not it. That's why that process is in place. Now you still have to look at the data. Also, the issue of nanotechnology and Elon Musk. Well, there's a fight out there. Immediately you mentioned it, I just said, let me check Google. I can see some scientists who are involved in nanotechnology fighting Elon Musk for calling it bullshit science. Funny. It's very funny. I don't even know the story behind that. I just know that there's a contention now between those who use nanotechnology and Elon Musk. Now, how does nanotechnology come into this space? People extrapolated that because nanotechnology was used in the delivery of Pfizer, that automatically means that our genes are being changed. Of course not. So really what's the issue about that? People might just get lost in this science, and that's why I didn't go too much. Molecule that covers something in a space. That's basically it, in tiny particles, that's all. So because the DNA cannot by itself be injected, a fatty molecule like a liposome is around it. So the DNA vehicle is in a water space where it can stay and survive till it gets into the human body. That's what it is about. That is not changing our DNA. We've been having different type of vaccine delivery. Thirdly, the issue that the vaccines, it's a virus and the natural immunity is better than the vaccine immunity. Well, if that was the case, then we would not be using any vaccine again. Measles, polio, yellow fever, all the vaccines we have, they are all not the natural immunity. So are we saying we should continue to let children die?
Okay, looks like Dr. Asinyabi is having technical challenges once again. There's another hand raised, Sylvester. I'm sorry, I can't pronounce your last name. Can you unmute and share your question or comment, please?
Sylvester.
Okay, thank you.
Good afternoon from Nigeria. Thank you.
Good afternoon, sir. Welcome to the conversation. We didn't intend for it to be contentious, but we welcome the opinions and the opportunity to learn. Thank you.
You're welcome. Thank you very much. I mean, for me, that the conversation is contentious, as it were, is part of life, really. I mean, we fight for what we believe in. And I think one thing you have done, which I must commend the organizers for, is allowing people with dissenting voices, as it were, opinions that are different from others to be expressed. And I think that is where this conversation in the larger space is having a problem, where people who think differently, who have questions, it is natural for people to have their own opinion. One can choose to see the cup as half full, another could see the cup as empty. What we need is to have an understanding and respect individual opinions. Now, I'm a journalist. I practice in Nigeria. Maybe if you look up the name, you could find it out. So there are lots of questions that a lot of people that I meet every day, they have. I see lots of articles, and I'm not going to shut out certain opinions because they don't agree with other people's. There are questions that must be answered. When this whole COVID-19 pandemic started, we were told that with the use of face masks, washing of hands, keeping of personal hygiene and social distancing, we could flatten the curve. And all around the world, that was what was happening. At different times, whether it was the first wave, it was subdued, as it were. And then we were told, even with a vaccine, a certain percentage that with infections, that these are, I'm a layman. I'm not a scientist, I'm not a doctor. I'm gonna say the way I feel about it. We were told that as people are getting infected, that we would develop a herd immunity, that anyone who is infected develops a natural immunity, and as such, would be able to withstand the virus anytime going forward. A lot of us at different times were diagnosed to have contracted the virus, as it were. Now, when the vaccine came, we were told, oh, with just a shot of the vaccine, everybody is fine. And once we can achieve a certain percentage, we attain herd immunity and we are good to go. And before long, it is changed again. Oh, one shot is not enough. Now, don't forget, people are watching. People are trying to understand. Not everybody is a medical doctor, but we use our own common sense. Why are the rules changing at every given time? What we are told, on one occasion, changes. Oh, it's no longer like this, it's now like that. And then the expectation was that when the vaccine comes, whoever gets a shot or gets that jab is fine. And then we are seeing people who were vaccinated getting infected and dying from the complications. And then we are told, oh, they need a second jab. And then they go for the second jab. And then they are still infected. They're still spreading. And somebody is upset that someone thinks that something is not right somewhere. It is either the vaccine is not dealing with the virus, or maybe something else is happening. Because if the vaccine is meant to deal with the virus, how come people who are fully vaccinated still get infected, still have to wear face mask, still die from the infection or from the complication?
So, Mr. Sylvester, thank you very much, sir. I just in the interest of time, I think I get the gist of what you're saying, and just sort of based on your timeline, you're asking some very critical questions. I'll hand it over to Dr. Asinyabi to please answer.
But quickly, I don't know if I've been muted, but just quickly, I would like to round off here. The respected Colin Powell just passed. We know what he's been dealing with. But the moment he died, we are attributing it to COVID-19. And then, okay, that he was fully vaccinated. And I'm a little confused again. If they had left it that he died from the cancer complication, I don't have a problem. But I'm having a problem with the fact that a man who is fully vaccinated still dies of COVID complication, whether of or from. But the expectation is that once you are fully vaccinated, you shouldn't die of the virus. So these are the questions that are begging for genuine answers. And until we have these answers that are acceptable to us, allow us to have a voice. Those of us who have these questions, and millions of people, if not billions, who have these questions, they should be accommodated in this space and not be written up and being ostracized. They can't fly, they can't go into public offices. But those who are vaccinated are now afraid of those who are not vaccinated. Something is not right. How could you be wearing your warm clothes in the winter and be concerned I'm not wearing a warm clothes, and telling me you will be cold because I'm not wearing a warm clothes? Or you are wearing a bulletproof, I'm not wearing a bulletproof, and then you are afraid that because I'm not wearing a bulletproof, you are exposed, you are at risk. These are things we can't reconcile. Thank you very much.
Thank you very much, sir. I really appreciate your questions and your submission. Dr. Asinyabi, can you please respond? Looks like Dr. Asinyabi is still having some challenges. I can speak a little bit to some of the questions you asked, and what you're saying makes a lot of sense in terms of highlighting the uncertainty presented by the vaccine and the thought that we should all be vaccinated. I'm the associate dean of a master's program, University of Maryland here in the US. And before the presentation started, I shared with everyone that I had worked from home for a year and a half, and I just came back to the office. And my responsibility, even though it's not necessarily in this role, I'm also a clinician. I'm a frontline person. I work in the trauma and critical care units, and I treat COVID patients. But other than that, I'm a healthcare leader and a senior leader in a university, an associate dean. And we had to navigate our students in terms of when students could come back to campus or when they wouldn't be able to come back to campus, and also put up mandates that includes vaccinations. And we had to deal with the constant changing of the narrative. And I think the most important thing that we should realize is, unlike other situations where malaria has been around for a while, where we're improving upon treatments, cholera has been out for a while, we have, treatment approaches, we're improving upon them over time. COVID-19 for us was new, and I think it is evolving and unfolding in front of us in real time. And the unfortunate part of that is it is creating questions, challenges, in real time that basically questions, the validity of the treatment we have available. I mean, that's my best explanation. Do we just not do anything about it? Nigeria is different. I live in the United States, and I have colleagues that worked in New York. There were so many dead bodies in hospitals from COVID-19 that there weren't enough morgues in the state of New York to handle the bodies. So they started stacking them on top of each other. There are videos, like real videos about this. The impact of COVID, yes, I mean, someone rightfully said it might be a pandemic, but the impact has not been the same across the world evenly. Developed countries, in many situations set the tone. Is there COVID? Absolutely. Have I seen COVID patients? Absolutely. Have I seen COVID patients die? Yes. Thank God I haven't had COVID. I was very sick last year, February, and I thought I was going to die, and I felt better. So are there odds that I've had COVID? It's very possible. My challenge is sitting and not doing anything about it. I see the vaccine as an opportunity. Is it the end all be all? Probably not, because your question about Colin Powell is a good one. Originally, when we first got the vaccine, I got my first vaccine in December of 2020. I got the second one in January 2021 because I'm a frontline worker. I had to be vaccinated early, way early. A lot of people were still, I got my first vaccine early December, last year. And I was under the impression that we wouldn't need a booster. And I believe that's because that was the information we had available at the time. That information is changing, and I think, we generally, should be a bit flexible too. With the changing information. That's the best I can do. And I'm just speaking from my personal vantage point, my experience. Dr. Asinyabi is the expert. Is the medical expert, who can speak to this. Seems like he's having some challenges. So Mr. Tobias was the next person that had his hand up. Mr. Tobias, you had a question or a comment. Can you please share? I see some questions directed to me, and I'll answer them in the chat. Do we still have Mr. Tobias here? I don't think we do. Mr. Baba Tokpe Faponda, and I'm sorry, your salutations are not here. So if you're Dr. Faponda, accept my apologies.
Hello, good afternoon. It is a miss, not a miss.
It's a miss. You know, accept my apologies.
So many
Yes.
times. And I think I should change my name, to be honest, but you know, it gives the air of mystery, to be honest. Thank you so much for such an enlightening time. We've had a good debate, I believe, and I just wanted to raise some concerns, especially for we who are in the finance sector of the economy, in the economics, finance, and politics, as it were. I'm not a medical practitioner, so I may not know the in-depth analysis as to the mRNAs and so on and so forth, as it were. But I have a bit of a concern, and I've asked this question to a number of professional friends, those who work in the medical field, who are friends of mine, who are in different parts of the medical field, and I have not received a reasonable answer. What I usually would get is people dancing around, people dancing around. My question is, this is Nigeria, and the research or projections were shown that Nigeria and the third world would be hit the most when the COVID reached its peak, as it were. But you find out that in Lagos, for example, the place is open with minimal, how do I put it? The place is open. People are not dying, as it were. People are not falling on the streets and dying. And so it begs to ask if, and this is proper finance and economics, if the COVID pandemic and disease were that bad, should it not have affected the third world more seriously than the first world, where the medical, your medicine is more advanced? Now it shows that maybe you have a thing or two to learn from Nigeria and from Africa, because I think we have gotten to a place where we have grown our herd immunity, and I think you need to learn a thing or two from us, number one. Number two, if you mentioned something that we're still learning about the COVID, if we're still learning, why make the vaccines mandatory to the extent of people being threatened to lose their jobs because they are not vaccinated? Mandatory to the point where people are being sacked, people are being ostracized, and we are creating an environment where it seems like the vaccinated are against the unvaccinated, like two tribes. Number three, you say that you're in the front lines and so on and so forth. Why have we thought of herd immunity? I know we would have, but why not read the research from the opposite side, in quotes, and learn from them? Because it seems, obviously, most of the people who are dying from research, from the numbers, most of the people who are dying from COVID-related, the COVID-related deaths were vaccinated. 1, 2 vaccines, 2, 3 vaccines. If there's a study from Israel out, someone posted that, I read it too, where most of the population who were hospitalized have been vaccinated. So does that not mean that the vaccines are not working and we should look at something else? You know, if my people would say that if something isn't working, the law of madness, for example, is doing something again and again and expecting a different result. That's the first law of madness. So I think that as the medical professionals, you're the ones on the field, you're the ones at the forefront. Shouldn't you take a step back, not be defensive, and learn from the third world countries, in quotes? How did they overcome this thing? Learn from those who are talking about vaccine hesitancy. They even call them anti-vaxxers. I really don't understand why they would call them those. And then the thing that pains me the most is that the vaccines, the companies who made the vaccines have a very serious indemnity clause, such that if people die, which we have the numbers of people dying and people having severe adverse reactions to these things, they can't be held accountable. They can't be held liable. I think that is a slap on the faces of the doctors, and it should be held responsible. And when this thing is over, some people would be taken to court. I really believe that, and I would stand with them. You know, it isn't when it comes to morality, we have a duty as medical practitioners to protect the people that we took an oath for. And you know, that's my suggestions, my comments. Thank you so much again for keeping this civil. I know that people would have emotions flying here and there, but thank you so much. I would take a bow now. Thank you.
Thank you very much, Ms. Fakonde. I really appreciate that. And we will take one more comment, and then we would ask Dr. Asinyabi to close us out. And I think Mr. Tobias made his way back. I want to give him the opportunity to speak because he's had his hand up the entire presentation.
Thank you so much, Dr. Beam Akintade. I hope I got the name correctly. It's been an interesting session that we've had, hearing people from different opinions, you know. And I just want to make some contributions as regards the COVID-19. First of all, I think I'm the one that asked you a question about what your opinion is concerning the vaccine mandate. And you said you were a proponent of the vaccine mandate. You know, while there are some advantages to the vaccination or having a large group of people getting vaccinated, let us not be overly enthusiastic as to trying to do the right thing. We now do the wrong thing. Let me give you some of the examples of mandates. If I don't know if you're a Nigerian who grew up abroad or what, but if you look at in the southeast of Nigeria right now, there are some group of persons who are the Igbos who having perceived, because I don't want to take sides with anybody, having perceived an injustice by the government, having felt that they do not really have a sense of belonging in Nigeria, they say they want to pull out. And a group of persons have taken it upon themselves to mandate others to follow their ideology. Not every single person in that southeast wants to pull out. And even for those that want to pull out, not every single one of them, you know, think that the way they are going about it should be the people. It should give education. It should find democratic ways and diplomatic ways of solving the current problems. Now, in science, you know, right from your time in medical school till now, and even my time in medical, I'm a medical doctor, you know, and from time in medical school till now, we know that every form of epidemic or pandemic that we've had to overcome, you know, we have done it via health education. You know, it has been via health education. You know, your passion to make something right should not push you into going against the will of others. Rather, you should seek to use the same passion to convince them, to win them over. And you can only do that by the right education. You know, right from the time that the pandemic started, there were a lot of should I say a lot of force that was used beginning from the lockdown. Almost everybody in the world embraced the lockdown. Why did people embrace the lockdown? Because they thought, man, if we could lock down for 14 days and we come out, everything is fine, then we're good to go. We've successfully fought this pandemic. And especially in Nigeria, with the fact that we know that we overcame Ebola, so we thought, okay, we can easily overcome this one. But since it became perpetual, because of that, people do not want to have their life perpetually under control, because human beings could go in the guise of fighting a disease and control people for other personal gains and all that. So I understand that part. So let us not be tools that we are professionals. Our care is for our patients. Our care is for our community. It is to ensure that we have the best and help them in every way that we can help them. Then secondly, I want to talk about immunity, because people have raised issues on immunity, natural immunity, the vaccine immunity, and all that. Now, for every disease, the immunity that is gotten from a particular disease and a vaccine is unique to the disease, and also unique to the vaccine. So let's not say, no, there is no vaccine that is 100% and all that. Yeah, that's true, but let's not use it loosely. For example, if you get the BCG vaccine as a child, you know that you know fully well that the BCG vaccine, even though is to help to fight tuberculosis, it gives you a kind of a form of relative immunity. It is well known that BCG vaccine is for relative immunity. So if you get infected with tuberculosis, assuming your natural immunity, which is the main immunity for tuberculosis, is a natural immunity. But if it's unable to, having the BCG vaccine gives you an advantage to prevent you from, from complicated illness or severe illness. That's what the BCG vaccine does. But for some life attenuated vaccines, and others, for example, the one for the chicken pox, that when you have it, it's supposed to give you a lifelong immunity. That's the expectation. And also, apart from the vaccine giving you supposed to give you a lifelong immunity, you having been infected with chicken pox also offers you a lifelong immunity. I got this information when I was in secondary school. And when I got infected with chicken pox, and I recovered from it, anytime I saw somebody who was infected with chicken pox, I was never afraid. I would go close to them. I will even eat with them while others are running away. I said, hey, I've gotten this thing before. I have lifelong immunity. And, I've never had a repeat. So every single disease is unique. So we need to know fully well, does COVID vaccine give relative immunity or absolute immunity? So far, it seems both COVID and the vaccine gives relative immunity, because people who have had COVID-19 have come back to have a repeat of the disease, and also those who have had the vaccination, we've also heard cases, of people who have been vaccinated who come back and still have disease. Of course, they said the vaccine is supposed to prevent you from having severe infections, but people still, a small percentage still go ahead to have the severe infections despite having been vaccinated. So this calls for multiplicity of measures. It calls for multiplicity of measures, not just focusing all our energy and effort on vaccination. We should also focus our energy on therapeutics. This should be very important to you as a doctor, because you know that the vaccine is not absolute. It's not absolute. It helps, but it's not absolute. So when people come down with the disease, what do you do? What do you do? Because they will, both the vaccinated and unvaccinated, they will come down with the disease. What do you do? So the place of therapeutics can never be overemphasized. It's very important that we should channel our energy, our resources, not just in talking about and educating people about the vaccines. We should also channel our energy, our studies, our researches, and our advocacy on having effective treatments. There are several that we have. Of course, for you to be managing patients, you know the protocols that you use to manage them. And we also have ours. Yeah, almost every institution, they have. If people come down with a disease, this is what and what you do. This is what I want. But it seems not to be emphasized because everybody wants to focus their energy on vaccination. But I tell you that is not good enough. It's not good enough to just focus our energy on vaccination. Then, lastly, I want to also talk about some of the implications when we're talking about immunity. Some of the implications of the measures that are being used. It is my opinion, and I'm entitled to my opinion, but it's a professional opinion, by the way. I'm of the opinion that the measures that we're using in preventing COVID-19 have its own or have their own disadvantages. What do I mean? For example, how do you acquire immunity? You acquire immunity by exposure. It's one of the ways you acquire immunity, by exposure. For example, if I'm exposed to a particular organism, in a smaller dose that is not sufficient for it to cause a disease in me, even though I have not come up with symptoms, I have been sensitized. So if I come in contact with it another time, it gives me an advantage to fight it better, even though I didn't even come down with a disease, because that you have an infection and a disease are not even the same. You may be infected, but you don't come down with a disease. So if I am constantly using measures that prevent me from even having the advantage of minimal exposures for a long time, it now causes a problem. It even dampens my immunity. So if, for example, we have a lot of mandates, the mask mandate, for example, if you consistently put on the mask every single place you go to, every single way, and it prevents you from these little exposures, it will not only have a negative impact on your personal, on the immunity or against COVID-19, but your ability to fight infections generally. And us in Africa, we are constantly bombarded with several organisms. So it's very important for us that we understand these certain steps that we are taking, the implication of them, because when I'm particular about this, I was never against these things, but since for some reason, it has been there for a long time, this protracted period of time will have a negative impact on us. So while we are trying to solve a problem, let us not create a bigger problem. Let the vaccination, the right education be given on vaccination, and let us win as much as we can, but never to mandate people. I totally disagree with mandating. It's against humanity. Thank you.
Dr. Tobias, if I were where you were right now, I would, we're not supposed to be in total close contact. This is based on my American understanding and how we're approaching COVID-19, but you have spoken very, very well, sir. And I really, really appreciate your perspective and your ability to put your thoughts and also your experience into words with also a charge, absolute versus, I think, that is the key here, honestly, but thank you very much. You've spoken very well. I put a link in the chat. We haven't done this before in the sense that, we would take a conversation from here somewhere else where we can try to create some consensus and to give ourselves an opportunity to impact a certain, aspect of healthcare, but Health for Nigeria wants to do something about this. Once again, for those who came in later, I'm the founder of Health for Nigeria. Someone posted in the chat that if I'm a facilitator, I should do my job and facilitate. Actually, I'm not just a facilitator. I'm the founder and the president of Health for Nigeria, and it's not monopolized. I mean, the goal is for us to help however we can. This is just one aspect where we're bringing in professionals to talk to us and educate us. But I think we can take that conversation, offline, and see how, we can be part of the solution. So thank you so much, everyone. I'm going to invite Dr. Asinyabi to give us some closing comments, and stay tuned because, our goal is to bring these types of topics and these types of platforms to us, so we can have, not only civil but educated conversations and come up with solutions that we can work with. Some of us want to serve, some of us want to be a part of the solution. So this is a great platform. Next month, I don't want to call it a controversial topic, but we know about the physician shortage in Nigeria. One of my colleagues here in the US is going to give us a presentation, and it's a suggestion. And I hope it has the same impact that it did on us today, but recommending, the potential for use for nurse practitioners to help bridge the gap, of the physician shortage. I'm not going to say any more than that. To hear more about that, you have to be here next week. So, sorry, next month, but you'll get an invitation. Dr. Asinyabi, can you give us some closing thoughts? Dr. Asinyabi, are you still with us?
Yeah. Yeah, he is. Yeah.
His network is bad now.
Yeah, I think it's having a few network issues.
I'm here. I'm just back now. Okay, so network. But so let me just say my closing remarks. Thank you, everybody, for being here. Thank you for listening. Thank you for raising questions. Thank you for pushing the boundaries of human understanding, and thank you for engaging. We should not stop asking questions, but however, let us know the type of issue. Secondly, I need to say that generally, just like every flu virus, the same way COVID is, we'll keep getting mutations, and we'll keep relearning and reimagining. I'm sure not every virus or not every pathogen behaves the same way. Chickenpox virus does not behave the same way as a yellow fever. I'm sure quite a lot of us have had yellow fever. You know that if you get the yellow fever vaccine, they will tell you that it will not be active until after 10 days. So similar to COVID, we've learned that now it will take like 10 days to 14 days before your shots become really effective. That's when your body would have raised enough immune response to protect you. So if you look on some countries' vaccination requirement, they will say 2 weeks after you complete a second. More for those first who have pre-morbid condition, because they are the ones that are more likely to die even if they get 2 shots. So like we see, we're all learning. These things we wouldn't have known this if time had not passed. Nobody would have known, even those who discovered the vaccines, they wouldn't have known because they could have followed people up for them to have died. So those are the things. So we are learning. We will keep learning. Let's keep engaging. Let's keep trusting each other, and let's believe proper science, not anecdotal science that cannot stand the test of time. But I really want to thank you for Nigeria for all you do. Program. We will continue to get better. Thank you very much.
Thank you very much once again, Dr. Asinyabi, and thank you to everyone who spoke today and also for sharing your opinions, Dr. Asinyabi. We truly appreciate you. We thank you for your time, taking time out of your busy schedule. Thank you to everyone once again today, and I appreciate your passion, and there was something people kept saying, we're winning, so let's also not lose sight of that. We're resilient people, let's capitalize on that. And if there's anything I would take away from this conversation today is, just having the opportunity to properly evaluate how this impacts us as a people, not just generally, not just the whole world, but how it impacts Nigeria as a people. So once again, thank you very much. We've created a link, let us continue talking, and not just to talk, but I mean, let this be hopefully a pathway to some positive actions, that can make an impact. This is how these impacts start, just from a group of well-meaning people. So thank you so much. We really appreciate your time, and sorry if this particular lecture took more time than we thought. Quite passionate people and a very important topic. So thank you very much.
And sorry, before we close, so if I might add, I know a lot of people are having concerns about WhatsApp. We currently do not use Telegram ourselves, so we will try to set something up so that people who are more comfortable on Telegram can also join the discussion there as well. So I'm going to put our email address, that's our official email address, into the chat. So that's info@healthfornigeria.org. So please, if you're interested, you can send us a message there and we'll share the link there as well. Those who are currently on the WhatsApp group, once we set up the Telegram, we'll put a link to Telegram there, and then everybody can port over to Telegram if we're more comfortable that way, just so that we're catering to everybody who has concerns about WhatsApp. Thank you again. As Dr. Akintade said, this discussion has probably been one of our most engaging we've had, and for very good reason. It's something that's critical discussion, critical thinking is very important. I think something that was brought up in that we're not trying to silence anybody. We want to hear every single person's opinion, understanding that there are concerns and there's awareness that comes around with things like this, particularly when it's affecting everybody very differently. So please join us further on WhatsApp, Telegram, so that we can have better discussions. We can learn more about what are people's concerns, and that we can also try to learn together and grow together and understand more, not coming from different angles, but trying to see that we're sitting at the same side of the table, looking at a problem and trying to solve that together. So thank you all so much once again.
Thank you.
Sorry,
yes. Can I just, I saw a link, a Telegram link posted by Olumide Obe. Is it valid?
Yes.
Can we go?
Olumide Obe is one of our staff. Yes, you can do that.
Okay, that's fine. So thank you. And if you just give me 30 seconds to say thank you also. This is Dr. Biodun Fasimi. Thank you very much. I engaged more on the chat section than I spoke, and I look forward to be having an excerpt like the comment, all the comments and questions from the chat room, if they can be copied out and posted on the Telegram group, so that at any time anyone joins the Telegram group, they can see how the conversation started from today. And like you rightly said, this has been extremely engaging, listening to everyone on every side. And I think you should also be excited that you have people from Nigeria who are indulging and in good research to understand what is going on, because that's where dialogue starts from. When you have people who are very educated on these matters. And we're gone are the days where we just take anything the way it's given to us. We have to look at it more critically. And this is hope for Nigeria, that things are going to get better. So I look forward to knowing more about your organization and seeing how we can be a part of what you're doing. Thank you very much. Have a lovely day.
Fantastic. Thank you very much, Dr. Fasimi. Very well said. Thank you.
All right. So as we're closing off, I will just share with us a short video on who we are, what we're doing, and just implore us to continue to engage, working for well-meaning, educated and strong Nigerians to join us and help us to make healthcare a priority in our country. So thank you all so much.
Nigeria, a nation with a population of over 200 million people with only 35,000 doctors. That is one doctor to 53,000 Nigerians. The healthcare allocation is 3.5% of the GDP, $5 per person per year. WHO recommends 5%. This explains why our healthcare system is the way it is. Patients are not being attended to. Government hospitals are overcrowded. Health workers are overwhelmed. Private specialists are unaffordable. Something has to be done. To tackle these issues, Health for Nigeria believes the healthcare sector needs an inspired and well-motivated group of young leaders to canvass and act for excellence in the healthcare standards of Nigeria. Our team of healthcare professionals and leaders are committed to improving access to healthcare for all Nigerians, especially our children. With our nurses in all basic schools in Nigeria, we give children basic health education and support across Nigeria. Health for Nigeria, health equity for all Nigerians.
All right, thank you so much, everybody. So I'll just give us time to gradually move along. Thank you so much for your time. I know this has gone a little bit longer than we proposed, and we're hoping that we can have further discussions outside as we learn more about health for Nigeria and about the coronavirus. So thank you all so much. Pray we all have a wonderful day.
Bye.